So here we see Lisa, a lovely young lady who unfortunately has some cavities in some of her back teeth. And if we have a look at those teeth, you can see them here. These are back teeth. There are some cavities on the chewing surfaces of her back teeth and in between several of these teeth. These cavities in between the teeth were discovered on x-rays as they're not really visible when you do a visual exam. So we've numbed her teeth up, and a rubber dam has been placed to isolate the area from saliva and also to prevent any of the materials that we're working with from entering her mouth and prevent them from being swallowed or worse even aspirated. You can see also the white filling on the very back tooth with a little cavity on one side of it, and there are cavities visible on the chewing surfaces of the two teeth in front of that. So what we do is we go ahead and remove all the old filling material at the decay that's in between the teeth, and we shape the cavity preps so that they're in a form or a shape that is appropriate for filling or receiving the new white fillings. And here you see the cavity preps have been prepared. The next stage is to start to fill the teeth. So we fill these one at a time because we're using white composite resin to fill them. And we put a matrix band around the middle tooth first to provide a matrix or a shape that the soft resin material can be pushed into and formed into, because it's soft and it needs a form to help support it until it is cured or hardened with the curing light. There are two small wedges at the front and the back of that middle tooth that helps the matrix band adhere closely to the part of the tooth that's down at the gum line, and this prevents some of the filling material from being squeezed out below the band and into the area at the gum line, creating an overhang that that would provide an area of plaque accumulation and irritation to the gum. So this matrix band is carefully fitted and the wedges carefully applied so that we have a filling matrix that will allow the material to be closely adapted to the tooth. And we do one tooth at a time because it's important to get tight contacts between the teeth, and if we have double matrix bands, then there's going to be space between the teeth, and it's likely that food will be caught in that area. So white fillings often take longer to do and are more challenging to do because you have to do them often one at a time like this. So the first step in the bonding process is to place blue phosphoric acid gel over first the enamel and then the dentin. We do this for about 10 to 15 seconds, and this etches the surface of the tooth structure and microscopically roughens it. Tiny pores are created so that the filling material can actually be mechanically locked into place. We then wash the etching gel off after it's been on the dentin for about 10 to 15 seconds and the enamel a little bit longer, and wash it off, and the tooth is lightly air dried. This allows the bond that we're going to put on next to actually adhere to the tooth structure. So the next stage is, after the etch has been washed off, a primer and bonding agent, or a liquid resin, is rubbed into the enamel and the dentin with this soft brush that you see here. The bonding agent in the primer is a liquid, and as such it flows easily into all the little tiny nooks and crannies in the preparation and into the tiny pores that were created on the surface of the dentin and enamel by the etching process. We then thin the excess resin with a light stream of air and evaporate the solvent, and it's ready to go on to the next step. The bonding agent that is being used here is Prime and Bond NT, made by Dentsply International. The liquid bonding agent is now set with a high power curing light, and this hardens or cures the liquid. It's in a handheld unit. You can see it produces a bright blue light that's in the visible spectrum of 385 to 515 nanometers. The bonding agent, now that it's cured, is micromechanically locked or bonded onto the tooth surface. So to give the filling its needed bulk and shape, we add several layers of another type of resin, a composite resin, which is a putty-like material. And this is added and light cured in increments. Each layer, as it's placed, forms a chemical bond with the bonding resin that we placed in the first step, and then each layer of composite resin bonds to the next. The layers are sculpted and shaped as we go along here, trying to recreate the natural tooth anatomy. The resin that you see being used here is Tetric Evoceram by the Ivoclar Vivadent company. And so bit by bit, the tooth is built up to its natural shape again in increments. We do it little bit by little bit because there is some shrinkage that occurs when the resin is cured, and we try and minimize that by adding small bits at a time. So once adequate resin has been placed and each layer has been cured, the matrix band that was supporting the placement of this putty resin is no longer needed. So we take it off and we shape the tooth that we've just worked on, take off any excess, and the adjacent teeth can be filled. It's necessary to, as I said, to treat one tooth at a time so you get a proper contact between the teeth. So in this slide, you see the middle tooth has been filled apart from the one area that had been covered by the matrix band that still needs to be done, and the two adjacent teeth are ready to be filled. So now a sectional matrix band is placed on the tooth in front of the one that we just worked on, and a wedge is put there to hold it tightly at the gum line. This type of sectional matrix, which is made by Danville Engineering, with the little ring that you see holding it in place, allows a tight contact to be formed between the second tooth and the first one we filled. It temporarily separates them very, very slightly and allows this tight contact to be formed. So the second cavity is etched with the phosphoric acid again, thoroughly rinsed and lightly dried, same as the first. And the bonding agent, Prime and Bond NT, is again applied and thinned with air. The bonding resin is now light cured, same as we did the first time, and the cavity is filled with the putty-like composite resin, and then the entire process is repeated for the tooth at the back. So here we see all three of the teeth filled, and they've had their final contouring and sculpting completed to shape them into natural tooth anatomy. Each step in this process is very critical. It must be meticulously handled if you want to ensure a long-lasting filling and to prevent postoperative sensitivity. If any step is not handled correctly, if there is any contamination by saliva, or if the teeth are over-etched, or if not enough bonding resin is placed, or the composite resin is placed in layers that are too large, you can end up with problems of sensitivity or gaps in the filling that would allow breakdown and recurrent cavities forming around it. So this bonding process has to be meticulously handled to ensure success. Now the rubber dam has been taken off, and we check the bite to make sure the teeth fit together properly. And then after that, the fillings and the composite resin are polished with various instruments to make them very shiny and natural. You can see that the final result looks very tooth-like. It's a very natural appearance, and these fillings should last and give years of comfortable service.